Hello, my name is Victor Marcial Vega. I'm a radiation oncologist by training, medical doctor. I'm licensed in Puerto Rico and Florida. And I'm also board certified in integrative medicine. And I've been practicing integrative medicine and complementary medicine and nutritional medicine for about 24 years. And since 1997-98, I've been using different types of ozone technologies to treat not only my cancer patients, but patients with all kinds of situations due mainly to stress, pollution, lack of good diet, and lack of exercise. So ozone has been a great adjunct because ozone breaks down hydrocarbons into CO2 and water, making it much easier for toxins to exit the body and also to oxygenate the tissues in such a low oxygenation environment that we live in today. So I have been using for almost 2 decades ozone showers, ozone steam baths. I even built my own technologies in the early 2000 years, and found it to be an extremely useful thing, especially for cancer patients with stage 4 or any other stage, but especially for stage 4 that are one of the toughest medical problems that we have today in the planet, patients that have advanced cancer. So if he can manage advanced cancer, he can manage other illnesses or diseases such as viruses, arthritis, high blood pressure, diabetes, Alzheimer's, autism, because these all have the same causes, what I mentioned earlier: pollution, lack of exercise, stress, and faulty diets, and a combination of those 4 things. So I bought the Hocatt about a year ago, and I've been using it in my clinic in Puerto Rico with great success and results, because after all this last 2 decades, I found it to be compact, easier to use than the earlier models that I used and that I built, and very versatile, digital, and comfortable for the patients, as well as safe, which is very important. And we've been managing patients in this technology as an adjunct to all the other things that we do, and we found it to be, in many cases, even as effective or more effective than intravenous ozone, which we use a lot in our clinic. So the fact that we have an option that doesn't need to be given intravenously, and is at least seems to be at least as effective, so that's a very positive thing. The other thing that we saw is a much faster increase in energy in the patients that use the Hocatt bath. And of course, I recommend it to be used 2 to 3 times a week. Once a week, I don't think is enough, although it can still give a benefit. I recommend 2 to 3 times a week for a total of 9 treatments, and then we repeat all the blood work again, or the studies, and make comparisons. And we've seen the changes in the skin, lighter skin in terms of moles or keratosis, sun spots, and things of those nature, benign spots that can turn into malignant, respond very well in the skin. We can see the skin changes even in the face, which is outside of the enclosed steam bath oxygen area, because of course this therapy affects the whole body. And the fact that patients are also breathing oxygen, not only getting steam and ozone through the skin, but it's a multi-modality approach that works very well. So we have been substituting the protocol that we do with intravenous vitamin C and intravenous ozone with intravenous vitamin C and the Hocatt ozone steam bath because of the speed of the results that we see. So we're in the process of adding the carbonic acid now to see what other results we get, because we've been adding things one at a time to see the effect of each thing. So we've done the aromatherapy, the light therapy, the oxygenation by nasal cannula, and of course the ozone and steam bath modality. And we found it to be very effective. Some patients that do 9 sessions can retain the benefits up to 2 months afterwards. Of course, we have to keep in mind that we are in a contaminated and very polluted planet, so we cannot rely on just 9 therapies of anything. We have to continue doing follow-up and maintenance situations daily to keep our bodies and minds clean. So the Hocatt is definitely here to stay in my clinic. We're even thinking of expanding and getting another one because of the positive results we've seen. And of course, it's part of our cancer protocol at this moment. It's been since the 90s. We found it to be very useful to increase the results that we're seeing in our patients. So thank you very much.
Doctor, I just want to ask something. You have been getting great results with your stage 4 cancer patients. Can you maybe just tell us some of your results, your percentages of results that you're getting?
The results of the initial patients that we saw with other ozone machines, but basically they deliver very similar results because they will deliver ozone and heat through the skin. Initially, we treated 36 patients with stage 4 cancer, and after 3 weeks of treating them 5 days a week with the ozone bath and intravenous vitamin C and massage and also nutritional supplementation, we had almost an 80% and more than 50% reduction in the tumors. So this was quite an achievement at the time. Of course, if the patients don't continue, most of them will continue with regrowth of the tumor. We have to think of this as a long-term 6 months to 1 year approach, and then you can think of a maintenance after that. But those first 3 weeks of that initial study was to prove to myself that pollution was causing cancer. So once we found a modality that removed it effectively, like ozone and steam bath, that not only makes the body sweat and push it out, but also the ozone breaks down hydrocarbons like plastic, petroleum derivatives, pesticides into CO2 and water to help its excretion, then we knew that we were in the right path to develop detoxifying pathways. And now we're putting the data together to get more cancer patients into the Hocatt, because now the Hocatt is being used by all kinds of patients, not only cancer patients, but anyone that wants to detoxify, anyone that wants to feel energy, wants not to feel depression, anxiety. So it's being used for a lot of other things that we were not using it in the 90s and early 2000s. So now we're using it in a more multifaceted approach.
Thank you very much.
Thank you very much.